Hi, Brittany. Hi, JoJo. I'm Billy, and this is Luke. We're
Okay.
pediatric nurses, and we wanted to thank you for taking your time to join us today. We're going to talk about a very common respiratory illness, viral respiratory illness in children called RSV, which stands for respiratory syncytial virus. You want to make sure as a parent or a caregiver you understand what it is, how to recognize it, and how to take care of the child at home and when it's time to seek medical help. Our goal here is to give you clear, helpful information in a way that makes sense and easy for you to remember. So we have a PowerPoint and then we also have some handouts as well. So this is what we're going to go over: RSV symptoms, prevention, home care, and then recap and questions at the end. So, what is RSV? RSV in short is short for the respiratory syncytial virus. It's a virus that causes inflammation in the lungs and the respiratory tract. In fact, it's so common, and most children have been infected by the time they're 2 years old. Um, in older children and adults, it may only cause a mild, like cold-like illness. But for infants, especially those under 12 years of age, oh, we lost our PowerPoint. But so for children under 12 months of age, premature infants, or children with lung or heart problems, it can be more serious. Um,
We're back.
okay. So what RSV does is it infects the airways in the lungs and it remains in the upper airway, like the nose and throat. The symptoms might be mild, but if it travels to the lower airway, the bronchioles, it can cause bronchitis or pneumonia, meaning the small passageways swell and fill with mucus and makes it harder to breathe. So up here you can see that most children are infected by age 2, but it's really common and it can cause many issues. So some of the symptoms we want to look out for, they're pretty common to a cold: a runny nose or congested nose, a dry cough, low grade fever, sneezing, a sore throat, and maybe headaches. But for infants, it becomes more serious. You may notice like short, shallow, rapid breathing, and the muscles pulling in under their ribs or around the neck. Those are called retractions. We got nasal flaring, where the nostrils will widen when they're breathing in. Wheezing, which is a whistling or a high pitched sound when the child exhales, or difficulty breathing, poor feeding, usually tiredness or irritability, and then a bluish color around the lips or the skin. That's called cyanosis, which is a lack of oxygen. Um, this section is especially important. You should seek immediate medical attention if your child is having any difficulty breathing, for example, chest or rib retractions, nasal flaring, blue lips, or if the child is so tired that they're not eating or drinking.
Alrighty. Now I'm gonna step in. Like Billy was saying, my name is Luke. I'm also a pediatric nurse. I'm gonna kind of go over some prevention tips. Obviously, with RSV, prevention is really important. Some tips would be, obviously, with anyone who's interacting with your baby, you're gonna want them to be washing their hands frequently, and then as well as teach you and your children how to wash their hands properly as well. Additionally, it would be lack of exposure of sick people to your child. Obviously, if they're being exposed to a bunch of sick people, that's not going to be helpful. Additionally, cleaning frequently touched surfaces. RSV can live and survive on different objects for a couple hours, and so if someone comes into contact with that, and then your child comes into contact with that, it's not great, and the risk for infection is high. And then using separate cups, as well as avoiding um, people who smoke with your child, it can have your child become prone to more respiratory illnesses. And then we'll get into home care. Um, so if your child has RSV but it's not severe, aka they're breathing well, feeding okay, and no blue lips, home care is often what you'll do. The important thing is babies breathe mostly through their noses, so if the nose is congested, it makes feeding and breathing harder. Using a nasal bulb suction, which is this thing right here, which I'll show you how to use, um, uh, helps decongest that nose. It'll make feeding and breathing easier. So you're going to want to make sure your child is hydrated. For infants, offering breast milk or formula frequently. For older children, age-appropriate fluids. Adequate hydration helps loosen those secretions and makes, one, if they're older, for them to clear their airway themselves, but if they're younger, for you to be able to clear their airway more easily. So you also, if you're going to be bulb suctioning, you want to keep the child upright or semi-upright. When resting, it helps with drainage and breathing. Monitor for any signs of worsening in breathing, poor feeding, lethargy, all those things that we talked about earlier. But then we'll get into the recap. So as we're reviewing, RSV is very common. It's not some like rare thing that your child has, but it can be serious in some cases, and that's why we're here and we want to teach you about it. You want to watch out for those signs like we were saying, difficulty breathing, retractions, nasal flaring, bluish lips, poor feeding, excessive tiredness. Those are all things that would indicate probably coming in and seeing a doctor. And then obviously prevention is very important. Frequent hand washing, avoiding sick contacts, cleaning surfaces, and avoiding smoke exposure. If your child has mild RSV, home care can be effective. Nasal suctioning, good hydration, correct positioning, and rest. But if you notice any of those warning signs, obviously come right in. Are there any questions that you have?
So like what if you're using the nasal suction and you can't, like what you're doing isn't like helping in that situation?
So sometimes that'll happen. Again, like we were saying, we want to loosen those secretions. There are certain things you can do like nose drops. These are over the counter. You can go get these at like Walgreens. Or if you don't want to go and grab those, you could even just go into your bathroom, turn on your shower, and have your room get all steamed up, and just go in there with your child and kind of just have them be breathing in that steamy air. It'll help loosen those secretions. And then I'll show you how we use these. You can take this home with you. I have this doll here for demonstration. So when you're using one of these nasal suctions, obviously you're gonna want those secretions loose, but you're gonna pinch this, get it all squeezed out, and then you're gonna go into their nostril and then release it, and it should suck some out, and then go until you can hear them breathing a bit better if they're struggling to breathe, and you just hear them having some just secretions in their nostrils. But yeah, I think
Would that agitate their nose at all, or is there a limit to how often you should?
I mean, it can. It's not going to be comfortable.
Yeah.
I know that not many children, infants especially, like things in their face. So it can be. I would just obviously be very aware when you're using it. Don't have it be attaching to their nostril. Make sure it's in the secretion and not just suctioning their nose. But yeah, I think obviously it's not going to be a comfortable thing, but other than that, it should not cause too much irritation if being done correctly. Okay. But then we have that handout that I gave you. I'll also give you that bulb suction, and we'll kind of go from there. Again, if you're seeing any of those scary symptoms, obviously come right in and see us. But if there's no other questions, I think we should be good to go.
Can she be at daycare if she were to test positive for RSV?
Billy, answer that one.
No, so she's not going to want to go to daycare until her symptoms are relieved for at least 48 hours.
Okay.
And then, can you tell me some of those those things that you would notice that you would want to go seek immediate help?
Yeah, so if she would be an infant, obviously under 12 months, we're worried about not being able to breathe out of the nose because that's the only way of their airway. So those bad feedings, nasal flaring, the sternal retractions, cyanosis around the lips, you would see. Obviously, you want to come in, and it's gonna mimic a cold, so fever, runny nose, but with those breathing things, they seek medical right away. And then under the age of 2 is where it's most common, which she falls under that. So now that she can kind of use her mouth and nose for breathing, just the same symptoms, but keep them upright for nasal suctioning. And
Okay. So on the handout we're sending home with you too, it has the CDC's website and the Mayo Clinic for if you have any like more questions and you don't have time to call us to ask.
okay.
Alrighty, well, thanks for joining us. It was great to talk with you. And good luck. Hopefully this clears up pretty quickly.
Perfect, thank you.
Thank you.